Hi, folks. It's Health Talk from Mars. It's out of this world, and welcome to another episode. In today's talk, we're going to be discussing Dr. Mildred Selig's book, The Magnesium Factor. And in this book, goes through vivid details on magnesium's effect on human health, including cardiovascular disease, hypertension, diabetes, atrial fibrillation and heart arrhythmias, stress, obesity, and athletic performance. So stick around. In today's episode, I'm going to be discussing Dr. Mildred Selig's work in magnesium. In her book, as outlined, The Magnesium Factor. In The Magnesium Factor, Dr. Selig goes through vivid detail of how magnesium actually works in the body at preventing various diseases. Dr. Selig has spent over 40 years researching magnesium and has published hundreds of studies on magnesium metabolism. In her book, she goes through fine detail on how magnesium prevents heart disease, hypertension, diabetes, cardiovascular illnesses such as arrhythmias and atrial fibrillation, as well as stress and also athletic performance. So Dr. Selig has really done an amazing job in her book discussing all of these conditions. If you want to learn more detail about how actually magnesium works, then this is a must read for everyone. And please note that there's a great appendix in the back that also discusses various tips concerning magnesium, how to take it, what type of supplements to take, and its effect on other nutrients such as potassium and also sodium. And so, again, this is a must read for anyone that really wants to get into some of the details and the science behind magnesium. So today I'm going to talk about 4 prominent points listed in Dr. Mildred Selig's book. There's so much in the book, but we're going to have to keep it limited to these 4 topics, which include diabetes and prediabetes, hypertension, cardiovascular disease, which includes arrhythmias such as atrial fibrillation, and finally, stress. In Mildred Selig's book, The Magnesium Factor, first area that we're going to cover is diabetes and prediabetes. In the Journal of American Medical Association, a few months back, they just came out with an article that half of the adult U.S. population is now either pre-diabetic or diabetic. So this is a critically important topic, and especially as related to magnesium and its role in preventing and enhancing the ability of the body to prevent diabetes and prediabetes. So in Dr. Selig's book, she goes into vivid detail on how when most cases of diabetes, the result is that there's an elevated level of insulin. Elevated levels of insulin means that the insulin is not working properly. And so to enhance the effectiveness of the body to control blood sugar, it starts making more and more insulin. Those increases in insulin increase excretion of magnesium. Increased excretion of magnesium results in tissues being deficient in magnesium, which results in less sensitivity of insulin. So you get into this vicious cycle that the elevated insulin causes problems with inefficiency of the insulin to work, and as a result, you increase the excretion, compounding the problem. So in a nutshell, in diabetes and prediabetes, magnesium is critically important to make sure that there's enough in the tissues. Magnesium is responsible for generating ATP molecules. ATP is basically what the body uses to generate energy. And one of the problems in diabetes and prediabetes is a lack of energy in the system. So making sure that magnesium is in ample supply in the tissues is critical in preventing diabetes and the sequelae of diabetes, which usually results in various types of paresthesias down in the lower extremity, as well as problems with tissue damage because the tissue is not getting proper blood circulation into them. Magnesium dilates your blood vessels and allows for the blood to get into the tissues that normally become deficient and eventually hypoxic. So make that a critical portion of how you treat diabetes. Okay, number 2, hypertension. Hypertension affects about 70% of the US adult population. So they've changed actually the definition of hypertension. There's a stage 1 hypertension, which basically means that if your blood pressure is over 130/85, then you now have the first stage of hypertension. So it used to be 140/90 was considered hypertensive, but they've lowered that value into an early stage hypertension. So as the blood pressure rises, more and more damage happens to the blood vessel walls. As that damage happens, various plaques start to build up and eventually occludes the artery and leads to either a cardiovascular event, such as a heart attack or a stroke. Or you could also get problems with deep vein thrombosis as well. So making sure that the blood vessel wall is relaxed is critical to preventing hypertension. And in Dr. Selig's book, The Magnesium Factor, she goes through vivid detail on how magnesium is in delicate balance with potassium and as well as sodium. And if the potassium level is also low, that can compound a magnesium deficiency. Magnesium is responsible for keeping potassium inside the cell. Both magnesium and potassium need to be concentrated inside the cell. We know that, for example, in the heart muscle, the heart is concentrated 20 times higher the level of magnesium as compared to the serum. And that also goes true with potassium. So they work hand in hand. In Dr. Selig's book, she talks about how potassium in foods and how potassium or magnesium in foods is really deficient, and we really need to basically supplement magnesium, as well as try to eat as whole food, plant-based diet as possible. What you need to know, and from Dr. Selig's book, is that magnesium is a critical player in the prevention of hypertension. Knowing what your level is and what your level of potassium is really critical. And she outlines that in the book, especially in the back of the book. She talks about various tests that you can do to evaluate the tissue level of both magnesium and potassium. So make sure that magnesium and potassium are a mainstay in the treatment of your hypertension. Number 3, cardiovascular disease. Cardiovascular disease is still the number 1 killer in the United States and most Western worlds. Cardiovascular disease is completely preventable, and one of the major factors in cardiovascular disease is a deficiency of magnesium. So there's a class of heart disease conditions, arrhythmias, which includes atrial fibrillation. And millions of people are affected by atrial fibrillation and other types of arrhythmias. These conditions are modulated in part by the level of tissue magnesium. As mentioned, magnesium is concentrated 20 times higher in the heart than it is in the serum. And that also goes for potassium as well. So making sure that your heart muscle is perfused with magnesium is really critical. In Dr. Selig's book, she talks about intramuscular injections as well as intravenous injections of magnesium to balance out this problem, especially in people that have really severe or advanced cardiovascular disease. So making sure that you are getting enough magnesium both in your diet and as a supplement is really a critical factor in treatment of cardiovascular disease and preventing heart disease. So if you have a family history of heart disease, a father or grandfather died in their 50s of a heart attack, you are critically susceptible to magnesium deficiency. So knowing your level of magnesium and treating that magnesium to get optimal levels in your tissue is critical to avoid repeating what's happened in the past in your family history. Okay, number 4, stress. So Dr. Selig makes a really special point in talking about how stress affects your magnesium level. So they actually work hand in hand. So a deficiency of magnesium will increase your level of stress by causing anxiety or mood swings or problems with inability to sleep, insomnia. So magnesium is a critical mineral in allowing your muscle tissue to relax and to basically get into that state of being, not stressed out. So one of the things that we know about stress that Dr. Selig highlights in her book is that elevated levels of adrenal hormones, which include norepinephrine and cortisol, actually work to increase excretion of magnesium, the opposite of what you want. So if you are stressed out, if you have anxiety, if you have insomnia, if you have mood swings, headaches, you definitely need to be taking extra levels of magnesium to balance out the stress. So stress is a major factor in reducing tissue levels of magnesium in the body. So again, make sure you get plenty of magnesium. Make sure you read Dr. Selig's book and the chapter on stress. And I think that you'll be really quite inspired to take more magnesium. So I had the opportunity of meeting Dr. Selig back in the actually early 90s at a conference. And I was overwhelmed with Dr. Selig's passion on just this one simple mineral and the research that she did. And so she inspired me to look further into magnesium physiology. And in fact, Dr. Alan Gaby was a big fan of Dr. Selig's. And he actually gave a wonderful lecture once, and he was sometimes referred to as Dr. Magnesium, about a patient that he had. It was a rabbi, and this rabbi was basically given 2 weeks to live. They had what's called cardiomyopathy, which is a weakening of the heart, swelling down in their legs. Their actually toes had turned black, so they weren't getting any perfusion of blood into their toes. They wanted to amputate some of the toes, but because they only gave the patient 2 weeks to live, they decided, well, you'll just, go home and make yourself comfortable. So Dr. Gaby actually took it upon himself to take this patient in and do intravenous magnesium drips. And in his treatment of this rabbi, over the period of several weeks, the patient's toes actually started to gain color and became pink again. And it was like, wow, that was a dramatic change. And in fact, this rabbi lived another 7 years, getting infusions of magnesium into them by intravenous drip. Now, if they had had a sustained release magnesium product, which is something that I developed called Cardiomagleplex. Cardiomagleplex is a 6 to 8 hour sustained release magnesium that simulates the effect of getting an intravenous magnesium drip. So this would have been something that would have been really useful for this rabbi to take. So what we know from Dr. Selig is really indispensable research on the area of magnesium and its effect on human health, including all the diseases that I just mentioned: cardiovascular disease, diabetes, stress, hypertension. And in the book, she goes through other things such as athletic performance and also obesity. So again, a must read if you want to know more about magnesium and its effect on the human body. If you want to find Dr. Selig's book, The Magnesium Factor, you can go online and find it very easily. If you want to know more about Cardiomagleplex, which is the sustained release magnesium product that I formulated over 20 years ago, you can go to my website, marsnutrition.net, and look further at some of the details on there, where you can also purchase the product as well. Thanks for listening, and stay tuned to the next episode from Health Talk from Mars. It's out of this world. Signing off now.